SABC, host broadcaster of the G20 South Africa 2025.
Right, welcome back to the venue where the G20 Social Summit is going to be taking place. This, of course, was started in Brazil. Brazil, of course, being the presidency last year of the G20. They brought about the Social Summit. South Africa continuing that Social Summit trajectory. And possibly one of the most important parts of the lead up to where the leaders are meeting this weekend, because this, as we described in the previous interview, is somewhat of the conscience of the leaders, because this is what civil society go through. This is what the average man on the street in these countries that are being spoken about go through. And this is where they put their issues to the fore. Now, quite an interesting one was obviously news coming out that we have seen and gotten wind of here is that the United States notifying the G20 members that will oppose a traditional leaders declaration at the 2025 summit in Johannesburg this weekend. Now, quite interesting, because we had that discussion about traditional leaders and what they were hoping for and how they are hoping that some of their lists and demands will also be, taken to the Leaders Summit where, something can come of it and you'll actually see this being ratified. But if it's left to the United States, they're saying absolutely not. They confirmed that the US has written a letter to this effect. So it'll be interesting to see what comes out of this one. But there are many other issues that are also under discussion here. And again, in the previous issue, the two issues that were brought up were education and health. And health is what we're going to focus on right now. My two guests that are going to help us unpack this, we've got Sibusiso Hlatjwako, who is the public health expert at Health Systems Trust, and Lauren Pretorius, who is the CEO for Campaigning for Cancer. Of course, both civil society organizations, and talking to us about health and what people need. It's great to have you, and thank you so much for joining us on the program. So let me begin with you, Sibusiso. If we look at the lead up to this, there's a very strong focus in terms of inequality, sustainability and resilience. Those are what the themes are that South Africa have adopted. From a public health point of view, why is civil society involvement essential in the lead up to this?
Well, civil society represents the public, and basically they represent the challenges, particularly in public health, the challenges that you have mentioned, inequality and others, especially in public health. And one of the things that probably as civil society we're looking into is the issues around health. And for this, we're looking into cervical cancer, which is one of the priorities that South Africa has placed for its G20. So we've got an event that we're hosting today that's speaking to G20, that's speaking to cervical cancer. And probably the question is, why cervical cancer? It is one of the leading causes of death among women with cancers. About more than 6,000 women lose their lives every year in South Africa to cervical cancer. WHO has actually placed what we call targets, 90-70-90 targets, where you're saying 90% of girls under 15 should be vaccinated for cervical cancer, and 70% of women that are 35 or 45 should be screened for cancer, and 90% of the women that are diagnosed with cancer should receive treatment. So it is a critical issue, particularly in low and middle income countries and countries that are part of G20.
All right, interesting. Cervical cancer being right up there as one of those discussed, and an incredibly important one. Lauren, from your perspective, and particularly from a patient advocacy point of view, let's talk to shaping global health commitments and the agenda that you come from, particularly with regard to cancer as well.
So I think, Leanne, at the end of the day, we don't have anything without our health. And I think that having a patient voice at the table and understanding what those needs and the lived experience are of patients is something we need to take into policy and take forward. We're also seeing, over the years that there's a change in the types of diseases that are affecting societies, particularly with non-communicable diseases. So for us, it's really important that we start to shape policy and understand that these are the diseases that the man in the street is facing. As Sibusiso said, looking at cervical cancer, prostate cancer, heart disease, as well as diabetes.
And it's massive, because when you look around the world, I mean, inequality, I imagine, falls directly, or health falls directly under inequality. And I say this because we look at the inequality in healthcare systems, and that's something that we as a country grapple with. And I don't think we're alone to this, but perhaps we have lived experiences that we bring to the table that perhaps we can see changes happening there. Do you want to weigh in on that conversation?
Yeah, I mean, cervical cancer, it's one of those diseases that have been shown to be disproportionate according to economy, income, and places as well. So one of the things that we're hoping for G20 is emphasis on that it's a preventable disease, so no one should be dying from it. So things like early screening, early diagnosis, treatment are things that are critical and are things that can move the needle. It's things that will help in terms of as G20 countries grapple with issues. I think one of the other things that makes it important is in May at the World Health Assembly, South Africa actually rallied the world to recognize cervical cancer as an issue, and the 17th of November, which was yesterday, was marked as World Cervical Cancer Elimination Day. Right. So I think as a country, South Africa is showing some leadership, but there is more that needs to be done. Our people in provinces, districts, communities, they need to be screened, they need access, and they need to get treatment as well.
I know your focus obviously is cervical cancer, but cancer in general, it's a big thing, and this is where I bring you into the conversation even more now, because the bottom line is that access to healthcare is a basic human right.
Correct.
And it feels like we're not getting it. I mean, if you're living in a rural area, you're diagnosed with cancer, it's almost like a death sentence.
So I think, Leanne, there's that old adage, where I was born shouldn't determine whether I live. And I think that we're still seeing that. We haven't solved that problem. Yeah. There are efficiencies in the systems that we're not looking at. And if we looked at the lived experience of the patient, we need to make sure that the patient gets the right treatment at the right time with as few challenges as possible. And that means going to understand what the patient needs. And as decision makers, looking at those challenges, things like transport, things like the stigma that you experience in your society. 80% of South Africans will consult a traditional healthcare practitioner before they go to a Western GP. That's something we need to take into account in our policy, and that's something that we can teach the world, because we aren't the only country that has alternate practitioners and health and cultural practitioners. These are things that we can teach the world and take forward our learnings into policy. Cancer in itself is, there's a tidal wave coming, and we're not ready for it. We've been working to work for it, but there comes a responsibility, I think, at policy to look at it and to implement the policies that we've done. We've done good work on policies. We need to implement them, and then for the public to understand what are their risks, what are the signs and symptoms, and seek treatment early. The thing with cancer is if you get it early, your chances are better. Yeah. And that if you can take down one message today, if there's something that's bothering you with your health, or there's a symptom that won't go away, speak to someone who can help you get screened. Yeah. We'll do the work at the policy level, and the man on the street needs to look at those symptoms and find help.
Indeed, and yes, we do know that they are traditional healers, and I just can't help but thinking the US's stance on what traditional leaders and not voting for that. But the reality is that how the world works. But I want to come to something that is vitally important as well. I mean, we know that as South Africa we have the vaccination that obviously assists for cervical cancer, which is a major milestone in the development of medical care. However, there still is inequality when it comes to these major health companies out there, these pharmaceutical companies, where things are far too unaffordable for people to actually get the right treatment. What do you speak to about that? Because these are big things. I mean, we just have to take a pandemic into example, and what happened during COVID. These are things we need to avoid going forward. And I think you've said it yourself, there's a tidal wave coming, and cancer is a pandemic that is just seeming to be growing faster and faster, and more people I hear are unfortunately developing cancer. What do we do? How do we make this voice heard? I'm going to give each of you a moment to bring one pressing issue that if you had to speak to these leaders, what would you say to them?
Yeah, I think you've mentioned the issue of vaccines, HPV vaccines, and pricing. I think for me, first of all, there's a role that governments should play, but there's also a role and a responsibility for private sector in terms of ensuring that these medicines or these essential medicines that are needed, particularly for cancer, are made affordable. And that doesn't start at the end point. It starts from clinical trials, ensuring that our people are involved, and also ensuring that there is agreements in terms of pricing. And then it's the issues around procurement, and then it's the issues around actual manufacturing as well. So, as a continent, we need to be doing more. We need to be making more of the medicines that are needed by our people so that we make them in the long run more affordable. There are issues around regulatory as well in terms of making those easier so that it doesn't impact the end price that's then pushed down to the patients. But I think the bottom line and the rule of thumb is there is a responsibility for private sector to ensure that medicines, especially essential medicines, are made accessible and affordable for the people that need them.
Absolutely. When you hear the pricing of some of these medicines and cancer treatment especially, to just stay alive, you're looking and running into hundreds of thousands rands a month. Now, people, we cannot afford that. What is your message you would leave with?
So my message is that innovation is needed in cancer. We don't have that, and we accept that innovation, but that innovation cannot cause more death. And we need to look at the value of that innovation and say, is this bringing value to the patient? Because at the end of the day, you can invest as much as you want in any innovation and trials and that. If it doesn't get to the patient, it's a waste of money. If it's not, all that knowledge and expertise that was used to create that medicine, if the patient doesn't get it, we wasted that medicine.
Well, there you go. Thank you for talking to us here, and good luck. Good luck for these next few days, and let's get that message across, because this is an incredibly important conversation. Health, but particular focus on cancer and putting that to the top of the agenda. Public health expert from Health Systems Trust. We've got Sibusiso Hlatjwako and Lauren Pretorius, CEO for Campaigning for Cancer. Good luck and thanks for your time to both of you. All right, let's get back into the Joburg studio now. Time for your news headlines at 8:30.
SABC, host broadcaster of the G20 South Africa 2025.